Hi, my name is Norrina Allen, and I'm here today to talk with Dr. He from Tulane University. He's going to be speaking about his trial, a cluster randomized trial of village doctor-led intervention on blood pressure control in the China Rural Hypertension Control Project. Welcome, Dr. He.
Thank you.
So I was wondering if you could talk today about why you did this study across China.
Hypertension is the leading global preventable risk factor for cardiovascular disease and the total mortality. More than 3/4 individuals with hypertension live in low and middle income countries. The prevalence of hypertension is high and increasing in low and middle income countries. Furthermore, the proportion of patients with controlled hypertension is low in low and middle income countries. For example, the proportion of patients with controlled blood pressure to lower than 140/90 was only 5.5% in rural China in 2014. Previous clinical trials show pharmacists, nurses, or community health workers lead interventions are effective in hypertension control. Non-physician healthcare workers could play a big role in hypertension control in low and middle income countries because physician shortages are common in those settings. The China Rural Hypertension Control Project aims to test the effectiveness of a village doctor-led multi-phased intervention on blood pressure control among rural residents with hypertension in China. Village doctors, formerly known as barefoot doctors, are health workers with some basic medical training who provide public health service and basic primary care in rural China.
This is a very exciting study, and it's really impressive about how many villages you had that participated. Can you talk a little bit about this cluster randomized study and what your findings were?
Sure. In this cluster trial, 326 villages with about 34,000 patients with uncontrolled hypertension were randomly assigned to the intervention or control groups. In the intervention group, village doctors managed the patients with hypertension according to a standard simple protocol with support from primary care physicians and the hypertension specialist. Village doctors also conduct health coach on home blood pressure monitor, lifestyle change, and medication adherence. Our study findings are very exciting. We found that at 18 months, the proportion of patients who achieved blood pressure less than 130/80 was 57% in the intervention group and 20% in the control group, with a significant global difference, 37%. The proportion of patients with achieved blood pressure less than 140/90 was 77% in the intervention group and 44% in the control group, with a significant global difference of 33%. Mean systolic blood pressure reduced by 26 millimeter mercury from baseline to 18 months in the intervention group and 12 in the control group, with a significant net difference of 15. Those are very big blood pressure reduction.
As you say, there are very large differences in the prevalence of control and decreases in blood pressure. What do you think was driving those differences and the intervention? Do you think that there's a specific component of the village doctor intervention that was responsible?
Yes. Village doctor in our study have the prescription authority. They can initiate and titrate medication. Also, they can conduct a health coach and follow up. Our study demonstrated that the village doctor-led multi-phased intervention significantly improved blood pressure control among rural residents in China. This feasible, effective, and sustainable implementation strategy could be scaled up in rural China and other low-resource settings for hypertension control. Those findings have important public health significance. Improving blood pressure control in low and middle income country will significantly reduce global burden of cardiovascular disease.
I think your findings from this study are particularly important when we think about how to control blood pressure in low resource settings. And so it offers a really exciting opportunity to think about how do we treat hypertension and control in those areas. Thank you so much for being willing to present with us today.
Thank you.